Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome to the Point podcast. My name is Erin Albert, Pharmacy Benefits Practice Lead here at Apex Benefits and Kinetic Health. Today, we continue our mini-series and celebration of pharmacy badasses from the past, present, and future. And specifically today, we start our conversation around the future of pharmacy practice and why and how it's important for pharmacy benefit managers and managers of healthcare benefits overall can better understand the role of how pharmacy has changed and evolved and will change in the future. I couldn't think of a better guest to kick this future focus series off other than Tony Dow. And Tony is a pharmacist. He received his doctorate of pharmacy degree at the University of Southern California School of Pharmacy in 2012. He's relatively new to the profession, but as well, he's already dived in. He does a lot of volunteer experiences, and he, along with some of his pharmacy IT colleagues, have put together a free course for other pharmacists to learn more about healthcare IT and informatics. Informatics is a growing area of the intersection of technology, data analysis, and healthcare. And Tony's already in the intersection. So my conversation today with Tony focuses on some of the newer areas coming, like social determinants of health, and how those factors like cost, affordability, even transportation can play into whether or not you can see your doctor. We also talk about telehealth and the impact of COVID-19 and how it's changed the healthcare dynamic and seeing your doctor. Give a listen to my conversation with Tony Dow. So we're here today talking about the future of pharmacy. And I have the privilege of following a lot of different pharmacists on LinkedIn. But Tony Dow is one of those guys that I've always wanted to have on the podcast. He is definitely entrenched in the IT arena and definitely has his eyes on the future of pharmacy. So I wanted to bring him into this mini-series to share his expertise with our audience. Welcome, Tony.
Thank you so much for, inviting me. I'm actually really honored and nervous to talk to you today, but, just really, really honored to be on the podcast.
We're just having a chat today, Tony. We're just friends among friends here. So I always start with the same question of all my guests. Tell us how you got to where you are today in your own career.
Yeah, so I guess for me, when I went to pharmacy school, I initially just went to school thinking that I would start working in the graveyard shift after school, like 7 on, 7 off. But when I got into school and then near the end of my time at school, I noticed that there was a field where you could integrate technology into pharmacy. And that was always something that was a big focus of mine. So throughout school, I learned more about the clinical side of pharmacy, and I really enjoyed acute care in the hospital setting. And when I learned about technology, that was kind of the technology integration and informatics was something I knew that I would be good at because I was always a techie before pharmacy school. And then going through pharmacy school, I was like that one guy in class that was like, oh, go to Tony, he can fix that, So that was kind of like my calling towards pharmacy informatics. So when I graduated, I pretty much leveraged my network of all my preceptors and all my colleagues. And eventually, after I got my license, I got interviewed at the Ventura County Medical Center, which is a county system in 100 miles north from where I live. And they interviewed me on a Monday, and then they asked me to start on a Wednesday. So that's how I got into that part. I got my foot in their door for that part. So after that, I just started working there, learning as much as I can on the job, and spending some time outside of my work hours, also learning more, networking with people at ASHP, part of a section of pharmacy informatics and technology. All of that kind of just got my brain to be an absorbent sponge of all this pharmacy informatics knowledge. as much as I could, as much as I am comfortable with. So eventually, about 5 years later, after working at Ventura County for a while, I was able to move back to closer to home. And currently, in my role today, I'm a pharmacy informatics specialist at a large pediatric hospital.
Awesome. So you're kind of at this super cool intersection between technology, pharmacy, and it sounds like the hospital and healthcare system. So overall, explain how pharmacists such as yourself can benefit from working in this kind of cool and kind of newer intersection of pharmacy practice.
Yeah, I can actually tell you up front that working at the intersection for, technology and pharmacy and hospice systems is not for everyone, but like if you enjoy it, you really enjoy it. So it's like a really different kind of mindset with a bigger picture. I also work as a per diem pharmacist at a different health system in the hospital. So, working in that setting as a staffing pharmacist or clinical pharmacist, you are focused on what you need to do, which is like patient care, immediate operations, things like that. That's the day to day process. But working on the technology side, you have a bigger picture view. So, like more high level view. So you're thinking about the entire medication use process. You're thinking about like all the different steps that go from medication being ordered all the way to being dispensed and then administered. So you're thinking about all these different ways that you can optimize the system and optimize patient care and delivery of care by using the available technologies out there. It's also a different mindset in terms of like how you work. So working as a staffing or clinical pharmacist, you're more focused on delivering the care for that day, working on the queue in the system, verifying orders, providing consultations, things like that. But when you're working with the IT systems, you're not just working in a silo, but you're working interdepartmentally a lot. What I really enjoy is collaborating with the other departments. So I collaborate with some of the people in nursing, some of the people that are the providers, like the MDs. So it's really interesting to see everything at a higher level. The other thing too is that you start learning more about like managing projects and understanding timelines are really, really important. And depending on which department you work at, you also have like different set of priorities. So in my previous role, I was under the pharmacy department. So even though I was working on technology and pharmacy was first. But now I'm in the role where I'm under the informatics department, which is a little bit more geared towards like making sure the systems are in place and appropriately working. So if there was like a big upgrade coming up, there's also a pharmacy priority that needs to be done. I had to figure out the balance of that, of like how to complete both, but still like make sure that they're both done safely and effectively. But to answer your question, how can pharmacists benefit? You get a larger appreciation on the medication use process and for operations and management. I didn't know a lot of these things until I was able to be part of that and experience all the technological improvements that we can do with the processes. And as a pharmacist, you are already ingrained in the med use process, but as informatics, you start to assess and identify the different holes in the process that can be improved with technology. The other thing that I really enjoy too is that you get to work with the latest and greatest and sometimes not so great technologies, but you have to test them and customize them as it pertains to your clinical or your operational workflow.
Yeah, I know with our employers through Apex Benefits, we get a lot of questions about remote real-time monitoring of diabetes patients, and telehealth has been such a huge question on the minds of a lot of our employers too, post COVID-19, which leads me to my next question. How has COVID impacted your practice as a pharmacist and within the health systems that you work?
I guess like for COVID specifically, how it affects my practice is that my focus has been more on projects that are a little bit more immediate needs for COVID. And I work in the hospital system. So those are kind of things like we need alerts in the system that will let providers know that, we're trying to order this medication that hasn't been proven for using COVID yet. And then it needs to be approved by so-and-so, like the infectious disease doctor or, things like that. Or the other thing too is that I have things tracking in the system for the diagnosis codes for COVID or suspected COVID, which I don't do, but my team does that part as well. And then the other part is like how COVID actually affects my own personal practice, which is we are not considered essential to be on site. So we are all working from home now. So it is remote work. The benefit for that for us is that it allows more project time and for more meeting times. And then, a side effect of that is there's less commuting and you're not in the office and people don't come to you with like the immediate day-to-day problems, then you have more focus time for like longer projects, bigger projects, and things like that. And the other side effect too about our remote work is that because we are remote, there is more tracking of what we do. But because of the tracking of what we do forces us to track, it actually forces me to be more efficient in my time management. So I'm actually, looking at my list of things to do and able to kind of divide parts of my day out so that I can focus on certain things. So that's been really beneficial for what I personally do.
This whole mini series that we put together for or in honor of Pharmacist Month or American Pharmacist Month here in October is past, present, and future. And I really wanted you to focus on the future because you're at this intersection of IT, informatics, and pharmacy. Where, Tony, do you see IT and pharmacy heading in the future relative to post-COVID as well as the healthcare systems that you've been working in?
Yeah, so it's kind of a cliche answer, but there's going to be a lot more technology integration. And as you know, or you may not know, yeah, technology in healthcare usually lags behind other industries. So I think in the future, we'll see more of the technology integration into our healthcare settings. For pharmacy, I see a lot of changes into how healthcare is delivered to patients. And I have, been speaking mostly about how technologies affect the inpatient space because that's where I work. But I think it's also important to acknowledge digital health and consumer health informatics tools. So pharmacists who aren't working as informatics pharmacists or pharmacists who are not working in some kind of company that does technology, you may think that you don't need to know these kind of things, but you really do because pharmacists are usually the most accessible healthcare professionals. And in the outpatient setting, they are the ones that the patients will see first. So they are the ones that patients will also come up to ask about, like, how do I use these tools? Like things like Bluetooth blood monitors or fitness trackers or remote patient monitoring tools or digital therapeutics. There's just so many other like consumer focused health tools, and they're going to be asking the pharmacist first because the pharmacist is going to be the easiest person they can reach out to. I see that technology is no longer a subspecialty in the future, but it's just something that we just all need to know at a very basic understanding level, at least, so that we can be more helpful to our patients. The other thing too is that technology should be embraced and like not to be scared of it because we still have that cognitive thinking. We still are humans with these like experiences and training, so we are able to kind of guide patients to be using these things. It's not that these things will completely replace what we have been trained to do. And then the other things too, because like all this technology is there, there's going to be more data that's being tracked. So all of that's going to be helpful in providing and producing like analytics models that can help with public health and predictive analytics. And I do want to mention too, because we're talking about COVID-19, is that telehealth adoption has been really, really rapid during these times because some of the clinics, they've been closed because they don't want to put the patients at risk for spread of COVID-19. So because of that, telehealth has been rapidly adopted everywhere. And even the government, they were reducing some of the barriers that were in place before in terms of adopting telehealth. So like some of the regulations for HIPAA, reducing how strict it is because they needed to have telehealth adopted quickly so that everybody can start using these things. With the adoption of telehealth, we also have issues about now it's very apparent that our internet infrastructure is not really strong everywhere. So it identifies a gap that we can also work towards fixing for the future as well. And one more thing I also wanted to mention is at the time of recording, about last week, there is a new field of informatics called social informatics that was defined by an article from people at UCSF. And it's really focused on social determinants of health and how we can standardize all of that information so that we can create data models and analytics so that we can improve patient care that way as well by focusing on how social determinants of health can affect how a patient is being taken care of.
Tony, real quick, I love the idea of social informatics and social determinants of health, examples of what social determinants of health might be. So in my world, I know, for example, if a patient can't get to their provider via car, that might be a social determinant of health. Other ideas might include things like affordability of copay. If you can't pay your copay, that is a social determinant of health that could be prohibitive to your care. So I love that pharmacists are getting into that arena. I think more and more Social determinants of health factors will be a bigger issue as we move forward, especially on healthcare plans on the commercial side. We see that a lot now with accessibility issues like wellness clinics and things like that as part of the healthcare benefit. So, Tony, what do you think pharmacy needs more of?
I think pharmacy does need more education in technology integration and informatics. Informatics is not just a small specialty, but like I said earlier, I think it will eventually be part of everybody's workflow and should be at some level, somewhat everybody's base knowledge as well. So eventually, I think the field of informatics and technology will be getting more specialized, and then the base knowledge should be everybody's education to become a pharmacist.
Agree. I also think there should be more education around pharmacy benefits as well, but I'll save that for another podcast. What do you think pharmacy needs less of, Tony?
There's a lot of negativity in pharmacy, so I do believe that it's something that we can have a lot less of. I do understand why that's the case. With the latest BLS survey of like mentioning how jobs are not increasing anytime soon. In fact, it's actually showing a -3% decrease for the next decade. So, we can be negative about it. And I am all for, feeling those emotions, but we can't really soak over it for too long. Feeling those emotions, like, I believe it's really completely normal to feel that. But after you feel it, what are you going to do about it? It would be more beneficial to kind of use that energy to channel it into taking some kind of action in how we can improve our situation rather than just continue the negativity.
Agree. And to your earlier point on the podcast, pharmacists are the most accessible healthcare providers. So, is there opportunities for pharmacists to move into different patient settings, such as concierge pharmacy, where you literally go to your doctor and then you have your appointment with your other doctor, your pharmacist, to go through your medications? In your field, in informatics, I think social informatics as well, the social determinants of health and how pharmacists can help their patients that way. I think there's lots of opportunities. So thank you for sharing that. So if we had to get to the one thing, right, there's a book by that title right now too. So if there was one thing that pharmacy's future really was dependent upon, what do you think that one thing is? And how do we improve it or get there?
So it's a really corny answer, but I really think teamwork is the one thing that we really need. And there's a lot of different healthcare professional settings, and I think it's really interesting in healthcare. Each of these settings or each of these fields, like MDs and nurses and pharmacists, and the list goes on. It feels sometimes that we are at odds with each other, and even within pharmacy itself, there's subspecialties in there too. There's people who kind of view each other in negative light. But I really think it's important that people understand each other and acknowledge that we are all playing a different part, but they are all important roles in the grand scheme of, patient care for our patients. And, we got to answer that question. Like, how can we help our patients if we can't help and support each other? Now, how do we get there? I'm not really sure, but that's something that I think all of us do need to work together to at least acknowledge that this is the issue and then work together to get there.
Yeah, I couldn't agree more. And I know people probably outside of pharmacy are not aware that pharmacists for over a decade now have been fighting to become official providers under the Social Security Act nationally. And currently, we're really not recognized as healthcare providers under this act, but we're hoping one day we may get there. So we appreciate you coming on the show, Tony, and sharing that. I think key is teamwork is absolutely necessary if we want to move forward as a profession. So, Tony, I want to give you the opportunity as well for you to share how people can connect with you if they want to learn more about your world as well. You're a podcaster. You are a fellow podcaster. So I'd love you to share where your podcasts are and where people can find you online.
Oh, yeah, sure. Thank you for giving me the opportunity to do that. So you can email me. My email is tony.dow.pharmd@gmail.com. And you can also message me on LinkedIn. I should be one of the few Tony Dows on there. So my last name is spelled DAO. And yeah, I also have two podcasts that I run. The first one is for the local organization in this area. I run the Orange County Pharmacist Association podcast, where we talk to different pharmacists or pharmacy students in different fields, or talking about different goals that students have, and kind of just share that with our membership or anyone who wants to listen. But my other podcast too is the Pharmacy IT and Me, which is a podcast really focused on informatics and technology integration. And every week or 2 weeks, I have a different guest on the podcast in between my other episodes, of like them sharing what they do, because the pharmacy informatics and technology field is very vast. And from one person to the next, we do so many different things depending on what's needed for us in that organization. So those are the two podcasts I run. But thank you so much again for giving me the opportunity to speak with you today, and also to share some of my thoughts and about my podcast. Another passion project of mine that I've done with a few of my colleagues, David Vu, Brian Fung, and Beiju Shaw, is the Pharmacy Informatics Academy, which we're trying to educate the next generation of informatics pharmacists. And our big first deliverable on that is a completely free course on a super, super high level introduction to what pharmacy informatics is. So you can also check that out at pharmacyinformaticsacademy.com.
Yeah, I love that you were nice enough to connect me to Justin Biok. And Justin and I did a CE on how to set up your APPE rotation remotely as well during COVID-19. So I know you know a lot of people in that space, in that pharmacy space, and at that intersection of IT and pharmacy. So thank you for coming on the show and sharing where you see pharmacy heading. I love that you have a very positive outlook on pharmacy as well. I think there's lots of opportunity to get better and improve as we go along, but I am so glad that there are pharmacists like you at the intersection of IT and pharmacy to help serve as a translator to ultimately provide better care for our patients. So thank you.
Thank you. It was really fun talking to you today.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.